Good morning, dear students. In this video, let us see about food poisoning. As you heard, food poisoning, very common problem which can be observed because people usually go for traveling and they may dine out, or there may be chance of purchasing the food which is unhygiene, or many of the other reasons may also contribute for the entry of the organism into the body. So here once again the dose matters. The quantity of the food, contaminated food which got consumed may leads to the symptoms of food poisoning. If contaminated food consumed in the low quantity, sometimes a mild vomiting or diarrhea can be observed. If severe symptoms are observed, then it should be get treated. So here are some of the facts and figures throughout globally we can observe related to the food poisoning, because this food poisoning is a global phenomenon which can be seen worldwide. Here is a report which says 351,000 people die because of food poisoning every year. It's a global phenomenon. Even in India also, some of the reports which give evidence related to this Bihar mid-meal poisoning incident which happened in 2013, which have leads to death of 23 students. And even in Indian Express also we can found many of the reported cases, especially in Mumbai and even in Pune, where food poisoning was observed in many other incidences. It's a report which was taken in 2018. So then let us see in detail about the food poisoning. Let us start with the definition. Food poisoning is a general term for health problem arising from eating contaminated food, whereas the branch food toxicology deals with the substances found in the food that might be harmful to those who consume sufficient quantity of the food which containing the substances. Let us see various types of food poisoning. We have different types and causes. The types like traveler's diarrhea, so usually caused by E. coli bacteria found in contaminated food and water, and we have salmonella caused by bacteria in contaminated poultry, egg, meat, dairy product. Although it can be fatal, and in most cases it may be very much mild. And we have botulism caused by anaerobic bacteria that is found in home cane products and even in honey. And we have viral type caused most often by contaminated raw seafood. And we have chemicals very commonly which can be observed. The main reason is the pesticide used in the cultivation and storage. So overall we can classify the causes as microbes like bacteria, virus, protozoa, and we have parasites, fungi, plant, fish, and chemical additives which will act as a causes for food poisoning. Coming with the diagnosis, collecting the history of the patient will serve for easy identification of the nature of food poisoning, and also collecting the clinical picture of the patient. Stool analysis can provide better information about the organism. So we have a separate guidelines for collection of the stool sample that will be discussed in the coming slide. And also sometime it's better to collect the suspected food sample, such that such agents can be sent for analysis, especially in forensic cases. Forensic laboratories we will be sending the food samples so that it will become easier to identify the nature of poisoning. And even measurement of the serum electrolytes can also give an idea about the food poisoning. So let us see about the general guidelines for collection of the stool sample. So here we will get information when to collect the sample and how much quantity of the sample should be collected. And after collecting, suppose in case immediately if you are not conducting the analysis, if you are storing it, how to store it. We have different classes based on the subjective causative agents like virus, bacterium, and parasites. We have, suppose we are collecting virus sample, within 48 to 72 hours it should be. Bacterium means during active diarrhea time it should be taken. Parasite any time it can be taken, but it should be taken as soon as possible. Then let us see how much quantity of sample should be taken. 10 cc stool sample should be taken. should be placed in a fresh stool sample in a clean dry container. It should be unmixed with the urine. Coming with the bacterium, 2 rectal swabs of fresh stool, moist and rectal swab can be taken. So after collecting, it should be kept in carry medium. So this swab should be inserted 1 to 1.5 inches in the rectum, and gently the swab should be rotated, and after collecting, the swab should be placed in the carry medium tube, and we should break up the top portion of the swab sticks such that easily it can be capped. And coming with the parasite, collect a bulk stool sample. It should be unmixed with the urine, should be placed in a clean container, and it should be placed in a proportion of 10% formalin polyvinyl alcohol, which will act as a preservative in a ratio of 1 part stool to 3 parts of preservative, and it should be mixed. Coming with the storage, virus can be refrigerated at 4 degrees centigrade. It should not be freezed. Whereas bacterium here, it can be freezed. Suppose you are not conducting the test immediately, it can be refrigerated 4 degrees centigrade. If test is not done quickly, we should freeze it for minus 70 degrees centigrade. Coming with the parasite, store at room temperature or refrigerated 4 degrees centigrade. Here we should not go for freezing. Then coming with the general treatment measures for any type of poisoning, it may be food poisoning. Oral rehydration treatment can be given, ORT. The main advantage of this oral rehydration, like we can restore the amount of the electrolyte and the fluid which got discharged from the body because of vomiting or diarrhea. So here diarrhea can be classified as mild diarrhea or moderate diarrhea. So here mild dehydration can be considered when 3 to 5% of fluid deficiency is observed, whereas moderate dehydration can be seen as 6 to 10% fluid deficient. So this mild dehydration can be identified by some symptoms of dry mouth and increased trust with the patient, whereas moderate dehydration can be indicated by dry mouth. Here shrunken eye can be seen as a symptoms of dehydration, and shrunken fontanelles and loss of skin turgor can be observed. These are some of the symptoms of dehydration. So rehydration should be commenced with a fluid which contains 50 to 90 milligram equivalent per liter of sodium. The amount of fluid administered should be 50 ml per kg over a period of 2 to 4 hours in a mild dehydration condition, whereas in moderate dehydration 100 ml per kg it should be administered. After 2 to 4 hour, hydration status should be assessed, and if it is found to be normal, maintenance therapy can be begun. I'll talk about the maintenance therapy in the next slide. Otherwise, we should repeat the rehydration therapy. So now maintenance therapy, here we will shift towards the oral rehydration solution. Should be administered as follows, like 1 ml for each gram of diarrheal stool, or 10 ml per kg for every watery stool passed, or 2 ml per kg for each episodes of vomiting. But limitations of oral rehydration therapy, because this ORT is not sufficient therapy in the presence of dysenteries, where blood diarrhea is observed, or patient has shock, or intestinal ileus, or intractable vomiting, or even high stool output more than 10 ml per kg per hour, or monosaccharide malabsorption observed in the patient, and lactulose intolerance, where ORT may not work. So in such condition, intravenous rehydration can be done. So it is necessary when dehydration is very severe, that's more than 10% fluid deficient or shock. So here you will be giving 20 ml per kg bolus of ringer lactate or normal saline or similar solution is administered until pulse, perfusion and mental status return to the normal. So here 2 separate IV lines may be required, or even alternate access sites should, such as femoral vein or venous cut down. Oral rehydration is commenced when the condition is improved. So even sometimes non-specific antidiarrheal agents can be used. Use of such agents which includes kaolin and pectin. Even anti-motility drugs can be given. Example is loperamide. Even anti-secretory agents are toxin binders. Say for example cholestyramine. So sometimes these agents may be controversial because if infection is the reason for food poisoning, if you are decreasing motility and if you have started treating, so there may be chance of spread of infection or growth of infection can be seen. With properly diagnosis, and later we should go with anti-motility agents. So now available data do not demonstrate significant benefit effect. Instead, serious adverse effects can occur, which include ELS and anticholinergic syndromes can be observed with non-specific antidiarrheal agents. Let us see some of the prevention of food poisoning, like buying grocery. Buy meat and seafood items only from the hygiene outlets. Do not buy items whose expiry date is elapsed. Do not buy items containing undercooked or raw animal derived ingredient. Buy only pasteurized milk or cheese. Do not buy eggs when it is cracked or leaking. The best way of treating food poisoning is prevention. So the prevention should start with buying of the grocery items. And coming with the storage also, take groceries directly home and store immediately in the refrigerator. Always store raw meat, poultry or seafood in a plastic bags so that dripping do not contaminate the other items in the refrigerator. Hot food should be eaten immediately or kept hot more than 60 degrees centigrade or refrigerated. While storing grocery, after purchasing, we should clean it and dry, and later it's better to store in refrigerator. And while storing egg, do not store eggs in the egg section of the door provided in the most of the refrigerator, since adequate cooling does not occur there. Place them inside cartons and store them in the main section of the refrigerator. Now let us see about the temperature requirement. Never leave cut vegetables or meat in an open. Refrigerate them or cook them. Ensure that the temperature in the main section of the refrigerator is always below 4 degrees centigrade and that of the freezer below 18 degrees centigrade. Cook all meat and seafood thoroughly before eating. Never consume undercooked. Cook eggs until both the yolk and white are firm. Never eat runny yolk. Reheat food or heat partially cooked food all the way through at least 74 degrees centigrade. If any food item looks or smell suspicious, discard it. It should not be used. And maintain hygiene. Wash hand utensils and containers with water and soap between preparation of different food, especially if you are using raw meat or poultry, fish or eggs. Use plastic or glass cutting boards for slicing vegetables or meat. Wooden boards are extremely difficult to clean and adequately. Wash fresh fruits and vegetables under running water, so that way we can maintain some hygienicity. And other aspect like dining out, avoid consuming undercooked animal derived dishes. Do not eat undercooked meat or poultry. Do not consume egg preparation with runny yolk. When while traveling, foreign traveling, drink only boiled or bottled water. Do not eat raw vegetables and salads. Do not buy food items from roadside vendors. So thereby we can protect ourselves even while traveling. So now let us see about the various microbial food poisoning. So here only introduction I will cover in this class, and in the next class I will take one example and I will be explaining it. Example is a bacteria. Bacterial food poisoning is most frequently caused by Staphylococcus, which followed by Clostridium perfringens, Salmonella, Shigella and Staphylococcus. So in the descending order of frequency they will cause us food poisoning. In the next class I will take two examples of bacteria and I will be talking about the management of food poisoning and identifying the symptoms and treatment. Thank you.